Hi, my name is Samara Mahendra and I'm the founder of Carer. We are an integrative oncology company. Unfortunately, cancer affects an individual on all levels, nutritionally, physically, psychologically, socially, spiritually. And cancer treatment can have and cause severe side effects. This can be nausea, suppression of appetite, fatigue, pain, psychological, mental, and emotional trauma such as fear, anxiety, depression, lack of sleep. Unfortunately, cancer has taken over our lives and is rising rapidly. More cancer cases today are being diagnosed because of lifestyle conditions and less of genetic factors. Using lifestyle to help manage cancer treatment side effects and expedite healing and recovery is essential. So what can one do when it comes to lifestyle? So let's start with nutrition. There are a lot of nutritional deficiencies a cancer patient experiences while going through cancer treatment. While the treatment is imperative, it has a lot of impact on your digestive system. And that is why we make it a point that all cancer patients get on strong pro and prebiotic rich diets. Probiotics could be in the form of dahi, homemade dahi, kefir, sauerkraut, kimchi, and fermented foods, so on and so forth. And prebiotics are like asparagus, onions, garlic. These are really good prebiotics as well. Consuming a lot of pro and prebiotics in your food really helps the digestive system and can also help with your immune system as well. Another thing that cancer patients face is a drop in blood count. So what can we do to at least minimize that? Pomegranates, beetroot, figs, dates, green leafy vegetables, moringa leaves. All of this has been considered to be very useful for keeping blood counts at the optimal level. Everyone knows about curcumin. It's an anti-inflammatory food, and just having a bit of curcumin with, say, organic ghee and a pinch of pepper can be a superfood and can be consumed on an everyday basis. How one starts their day and what they consume as soon as they wake up, and how they end their day and what they actually ingest just before going to sleep is very important. When we wake up, our stomachs are very acidic, and we need to make sure that we create some kind of alkalinity as soon as we wake up. So having a nutrients dense superfood concoction to start your day is important, and also maybe ending your day with a little bit of lemon water can be very useful. It can also help a lot with nausea. Another major side effect that is felt is nausea and lack of appetite. A lot of patients also end up vomiting. So ginger concoctions or adding ginger into your diet can be really, really useful as well. There are many things that cancer patients can do just beyond really focusing on their diet. It's their exercise, it's their physical movement, keeping the lymphatic system going, blood circulation is important, some form of movement, whether that's walking, whether that's yoga therapy, whether that's taking the stairs instead of an elevator. But moving to some degree can really help with fatigue, can help with pain, and can help with swelling and edema that could have resulted because of treatment or surgery that someone has done. And then the psychological element, according to me, is the most important. What are we doing to manage our mental and emotional distresses? What are we doing to manage stress levels, the fear that is associated with a cancer diagnosis? Meditation, counseling, connecting with a professional who can really help you psychologically and help you manage these emotions better is essential. There are many clinical psychologists out there, psycho-oncologists out there that one can actually reach out to and connect with. And we highly recommend that also the family members or the immediate caregiver also indulges in these counseling sessions. So when it comes to cancer, it's not about just getting medical treatment, it's about managing the person as a whole. It's about holistic therapies, that support a patient physically, psychologically, nutritionally, and medically. It is a multidisciplinary approach that has proven to achieve the best outcomes, the highest quality of life, and hopefully increase survival and decreases chances of relapse. Thank you.